We've all been there, right? Staring at a medicine bottle, the name's familiar, but what it actually does, total blank.
Happens to the best of us.
So today, we're tackling one of those meds, Diamox. And you've given us some really interesting stuff to dig into. Goes way beyond the basics.
Yeah, it's not every day we start a deep dive with user reviews, but I gotta say, the ones for Diamox, they caught my eye.
Totally. It's not like this is just, cough syrup. We're talking glaucoma, seizures, even altitude sickness. Pretty heavy hitters. And yet,
And yet, it's got a pretty decent average rating, like 6.5 out of 10. That's not bad, considering.
exactly, when you're dealing with those kinds of conditions, a 6.5 starts to look like a win.
Yeah.
So clearly, people are finding Diamox genuinely helpful, which is what we're going to unpack. The how and the why this little pill seems to do so much.
It's a good one to unpack, that's for sure. Lots of layers.
Before we get into the weeds, can you give us the overview? What does Diamox actually treat beyond the usual stuff?
Sure. So you've got your, as you said, usual suspects, glaucoma, certain types of seizures, preventing altitude sickness. But then we get into some more, shall we say, niche territory.
Hit me with it.
Okay, so periodic paralysis, idiopathic intracranial hypertension, even congestive heart failure pops up.
Okay, wow, that is a range. Eye problems, neurological stuff, even heart issues. I mean, are we talking like a domino effect here? This drug does something, and it just ripples out to all these different parts of the body.
You're on the right track. It all comes down to this enzyme, carbonic anhydrase. Diamox inhibits it, hence the name, carbonic anhydrase inhibitor.
Right, I saw that term. Honestly, though, it means like 0 to me. Eli 5. What does carbonic anhydrase even do that's so important?
Okay, so imagine tiny little workers in your body constantly converting water and carbon dioxide into bicarbonate and hydrogen ions. That's carbonic anhydrase in a nutshell.
Okay, I kind of see it.
And these little workers, they're busy in your kidneys, your eyes, your brain, all over the place.
And Diamox basically, you them to take a break.
Pretty much. It slows them down, throws a wrench in the works.
And what happens when these workers... I like that analogy, by the way. What happens when they get interrupted? Give me a concrete example.
Let's take glaucoma. So that's a condition where fluid builds up in your eye, puts pressure on the optic nerve.
Yeah, not good.
Definitely not what you want. Diamox, by inhibiting that carbonic anhydrase, it reduces the production of that fluid in the eye, relieves the pressure.
So instead of just, mopping up the overflow, it's turning down the faucet in the first place.
Perfect analogy. And this same mechanism, it plays out in other ways too. For instance, you mentioned altitude sickness. Diamox isn't just masking the symptoms there, it actually helps your body acclimatize faster.
Okay, now that is interesting, because I'm looking at this CDC website you included, and they're saying natural acclimatization can take days, which for travelers, that can really throw a wrench in your plans, right?
Exactly. Diamox speeds that up, can be as little as 1 day. Basically tricks your body into thinking it's already at a higher altitude, so it starts churning out more red blood cells. That's key for adapting to that thinner air.
Okay, so we've got glaucoma, altitude sickness. But this list of Diamox uses just keeps going. What's another one of those, wait, really, applications?
Let's talk about periodic paralysis.
Okay, I'm intrigued.
So it's a group of rare conditions. Basically, your muscles, they kind of misinterpret the signals coming from your nerves. Leads to these episodes of weakness, sometimes even temporary paralysis.
You're telling me this little pill that helps with altitude sickness also plays a role in how our muscles and nerves are talking to each other. What's the connection?
That's the million-dollar question, right?
Yeah.
And it's actually not directly fixing those faulty nerve signals.
Okay, now I'm really lost.
But remember those tiny workers we talked about, the carbonic anhydrase?
Yeah, the ones Diamox tells to take a break.
Exactly. So by affecting them, Diamox ends up influencing the balance of certain minerals in your body, potassium especially.
And that mineral balance somehow helps stabilize the muscle cells in people with periodic paralysis.
You got it. It's like solving a puzzle by accident almost.
Which honestly makes me wonder what else we might find out about how Diamox affects the body.
Yeah.
Are there other places where this mineral balancing act comes into play?
Oh, absolutely. We see it in how Diamox is used for edema, even in some cases of congestive heart failure. It's not just moving fluid around, it's influencing the composition of that fluid too.
You mentioned congestive heart failure earlier. I mean, that seems like worlds away from something like altitude sickness. How does Diamox even factor in there?
Another good question. And it really highlights how complex the body is. But basically, congestive heart failure often involves, you guessed it, fluid buildup. Diamox, by affecting that fluid balance and those key minerals can actually help manage those symptoms for some patients.
It's all so interconnected. Makes you realize that messing with one seemingly small thing, this carbonic anhydrase, has ripple effects throughout the entire system. Speaking of messing with things, one that stuck out to me was how the dosage for Diamox is all over the map. 250 milligrams for this, 1,000 milligrams for that. It's not like taking 2 aspirin, is it?
You're right, and that is crucial to understand. Dosage is not one size fits all with Diamox. The amount your doctor prescribes, it depends on you, the individual, and what you're being treated for.
So seeing a doctor, getting personalized advice, that's non-negotiable.
Absolutely. The wrong dose, it could be ineffective or worse.
Yeah, the information on overdose was a little alarming. Seems like messing with those electrolytes, it can really backfire.
No doubt. Dimax is throwing a wrench in your body's very delicate balance of minerals. Too much of that, it can become toxic, hard on your kidneys especially.
So monitoring is key, whether that's blood tests or just like really paying attention to how you feel, any weird side effects.
Exactly. Gotta stay vigilant with this one.
Speaking of side effects, I've heard about that tingling sensation some people get on Dimax. A friend of mine took it for altitude sickness, said it felt like her hands were asleep.
Oh, yeah, the tingling. That's a common one. And it goes right back to how Diamox works, actually. Remember those mineral imbalances we were talking about?
Potassium, right.
Bingo. That tingling is often due to changes in potassium levels, a direct result of the drug's effect on carbonic anhydrase.
So even the downsides can be informative if you know how to read them. It's like the side effects are another clue to this bigger puzzle of how the drug's impacting the body.
100%. It's all connected. And that brings us to another area you highlighted, concerns about kidney stones as a potential risk.
Right, because of how Diamox affects, the whole mineral balance thing we've been talking about.
Exactly. But here's where it gets even more nuanced. You also included info about how Dimax is used in treating certain heart conditions, and those involve the kidneys too.
So it can potentially harm and help, depending on the situation.
Exactly. It's a two-way street. Yet again, it highlights why medical expertise, really understanding the individual patient's situation, it's non-negotiable.
Got it. No DIY Dimax. But it's also not the only game in town, right? You mentioned there are alternative treatments out there. Anything worth highlighting?
I think the main takeaway is that while Dimax is definitely versatile, it's not a magic bullet, and it's not the only option for these conditions. Some alternatives work similarly, but they might have a different side effect profile. Others target the condition in a completely different way.
So it's about finding what works best for that person, not just what the textbook says.
That's it. Medicine, it's as much art as science sometimes, which is why having all the information, understanding the how and the why, it's so empowering.
It's amazing, right? One tiny pill, all these far-reaching effects. We've covered a lot how Dimax messes with those tiny workers. Love that visual, by the way, the carbonic anhydrase, to how it's used for all these different things, glaucoma, altitude sickness, even periodic paralysis, congestive heart failure. It's a lot to wrap your head around.
It really is. And we've seen it's effective for a lot of people, but definitely not without its, complexities. Dosage, individual reactions, really got to understand how it works.
Yeah, not a take two and call me in the morning kind of situation.
Yeah.
But, zooming out a bit, one thing that strikes me is how much the brain seems to be a recurring theme here.
Oh, for sure. I mean, we talked about glaucoma vision's a big part of brain function. Altitude sickness, that can do some wacky stuff to your thinking.
Yeah.
And obviously seizures, that's a no-brainer, so to speak.
Right. And then there's idiopathic intracranial hypertension, basically.
Yeah.
Pressure in your skull.
Exactly. So, yeah, the brain is definitely a common thread here.
Like Dimax is giving us this little window into how everything's connected, brain chemistry, fluid, stuff we wouldn't even think was related.
And what's so fascinating is it really highlights how much we don't know. We can see Dimax affecting these things, but the why, especially with something like periodic paralysis, still a lot of research to be done.
It's like Dimax is this accidental explorer, leaving clues about how our bodies work in ways we never even thought to look before. Makes you wonder what else we might find out, right?
That's the beauty of these deep dives, not just about the facts, but about getting curious, opening up new questions. And you've given us some great material to do that with.
Well, for our listeners who are now hopefully just as intrigued by Diamox as we are, where would you point them? What are some rabbit holes worth going down?
We touched on ion channels earlier, those faulty signals in periodic paralysis. That's a huge area of research, not just for muscle disorders, but all sorts of neurological conditions. If you're interested in the brain stuff, that's a good place to start.
I love it. Always more to learn. Well, on that note, thanks for joining us for this deep dive into Diamox. Way more than just a diuretic, that's for sure.
My pleasure. Fascinating stuff.
And until next time, keep exploring those rabbit holes.